Hi, my name is Leslie Zimpelman, and I am a nurse. I work at Cook Children's in the NICU, and then I also teach nursing at TCU in the Harris College of Nursing and Health Sciences. What led me to choose this career was actually my sister urging me to go into nursing. I had been a pre-veterinary student and wanted to work with exotic animals, and I could not get into veterinary school despite having a pretty good GPA. And so she urged me to go to nursing school, and I fell in love with neonatology. The education requirements for my job at Cook Children's required that I had a degree in nursing. For me, I got a bachelor in nursing, but you can get an associate's also. A typical day at the hospital for me is actually on night shift, so I get there at 6:30 p.m. I get report on what's been going on with my assignment or the babies that I will be working with from the nurse who'd been there all day, and then I take care of that patient for 12 hours until the next person comes along, which involves feeding them, monitoring their vital signs, intervening when necessary, putting in IVs, and a whole different array of nursing skills that might occur on a shift. When I think about my job, there are some parts that are my least favorite or my favorite. My least favorite is when I have a patient who isn't going to survive and I have to talk with the family about it. Usually the doctor comes in and has a conversation with them, and then they leave, and I have that conversation again with the family to make sure they understood what was going on and what the rest of our day is going to look like. So it can be sad at times. The best part is when I see a patient improving, or I know I made even just a little difference in their day, or had a great talk with a parent and just help them feel better about the situation. So the age patients that I work with in the hospital are anywhere from 24 or even 23-week gestation, so they're extremely premature, all the way up until 18 months if they've never been home from the hospital. So my patients haven't never been outside the hospital setting. That's the one difference. If they have gone home, they have to be back in our unit by age 7 days of life. How does this job affect my home life? Well, right now I only work twice a month in that capacity as a nurse, but when I did work full-time, it's hard. You have to plan because I had to sleep during the day, and so my kids went to daycare during the days after I worked or the day that I was going to go to work, so that way I could take a nap and be functional on the job and then recover for the next day. I typically did not work multiple days in a row when I worked full-time, because full-time nursing is 3 shifts a week, and if I broke it up, it allowed me to have more interaction with my family. If I worked all 3 in a row, I really didn't spend much time with them except for maybe a quick meal before I went back in for my next shift. A story about a patient that stands out to me would be, I had a very sick cardiac patient that I took care of, and we weren't sure if she was going to survive my shift. She was born with a congenital anomaly, so she was missing a ventricle of her heart, and we had to let her heart work as it was and keep her stable until we could potentially get her to surgery in the morning. She was sick. I hardly left the bedside all night. The doctor was in there a lot, and she just could not maintain her blood pressure or her oxygen saturations. Luckily, she did make it through the night, and they got her to surgery at the 7:30 start time. And the amazing thing is that she came back and saw us the next year after she stabilized and got home, and she's a healthy little girl. You would never know that she was has an artificial part of her heart if you were just talking to her. At the hospital on the day-to-day basis, I do work with a variety of people on my medical care team. I have care partners who have very basic degrees in the certificate to come work. They help me with vitals. They take, they'll change diapers, and they will feed my patients for when I'm busy with another one. I have a respiratory therapist who helps take care of my patient's respiratory status, so they monitor the vent, help run labs for me, they suction, and do any treatments that they would need on the respiratory side. I also have speech therapists who help us figure out the safest way to feed our patients. I have occupational therapists who look at how babies' hands are developing. Are they developing all those fine motor skills that they should be, even though they are sick and in the hospital? And we have physical therapists to work with their joints and positioning and make sure that nobody is developing contractures and that everyone is developing along the normal pathway or is normal for their diagnosis. I also have physicians and nurse practitioners, case managers who help make sure that we are moving along, dealing with their insurance. So do social workers. They help the family while the baby's in there get their insurance set up or Medicaid set up. Lodging for families, because we take patients from all over. We get them from Oklahoma, West Texas, South Texas, and East Texas. Some are as far away as 8-hour drives away. So they need help being in a new city. And then I also have lactation consultants who come in and help the moms with breast milk. So it's a whole array of people that I work with just to take care of one patient. If you wanted to be a nurse at Cook Children's, we hire our new graduates into a residency program. And that residency program is about a year long. And so you either sign up for the ICU track or you sign up for the med-surg track. And if you want to be a NICU nurse, you want to go for the ICU track, because then you'll get to come to the ICUs, the different ones. We have a pediatric ICU, which is for bigger kids. We have a cardiovascular ICU, which is where all of our heart surgeries occur. And then we have the ED, of course, that's part of that group. And then we have the neonatal ICU, which is where I work. You get to rotate through them, and then you tell us which one was your favorite, and if we agree, we put you in that location as a job after that. If you have experience as a nurse, you can hire straight into any unit you want, but right now, Cook's does not hire graduate nurses onto the specific ICU floors. They only go through the residency. I chose to work at Cook Children's because I knew it was such a magical place to work. The castle-like building, if you've never seen it, it's designed around an idea of Cinderella's castle. When you walk in, the ceiling is glass, and it's just looks really clean and bright. And we have lots of therapy dogs that come. We have a Build-A-Bear. We have, a little Camelot court is where we have lunches for people. So it's all around fantasy and just making it a really nice, fun place. The other thing that's made me want to stay is that I just love what I get to do in working with the babies. And I only get to do it a little bit now, so it's just little snippets of care, but it just gives me a feeling that I'm making a difference in what I do. Our unit is special. We have 113 beds. We are the biggest in North Texas, and we are the only ones who have private rooms. So our families can actually stay with their patient or their child all the time, okay? That is not happening in other NICUs. Other NICUs are in a pod system or two big rooms where babies are lining the walls, parents have visiting hours, and they can't spend the night because there's nowhere for them to sleep. So we're seeing such better results for the families, and their stress levels are down because they actually get that better bonding with their child than they are at other hospitals. And so I just love being a part of that magic.